And I'd like to now introduce our last panelist from Region 4, who is Stel Bailey from Fight 40. Stel is, in fact, the Chief Executive Director of Fight 40, Fight 40, co-facilitator of the National PFAS Contamination Coalition, certified in wildlife monitoring, and is a content administrator behind several online publications. Bailey's life took a dramatic turn in 2013 when her father, brother, family dog, uncle, and herself were diagnosed with cancer. Her family's case was so unique, a genetic counselor invited them to do genetic testing, which showed no known mutational genes, indicating that they did or should not have an increased risk for developing the disease. Determined to find answers, she began to crowdsource other cancer cases in her hometown on Florida's Space Coast. As she spoke out about her family's case, she connected with many others affected by diseases in unique ways. As a cancer survivor and military dependent, Bailey is passionate about helping families and veterans prevent disease by sharing her insights about harmful toxins and their health effects. Her broad knowledge in coordinating community engagement projects has resulted in various opportunities, such as contributing to local publications and speaking at events sharing environmental health education. She has led additional efforts that focus on harmful contaminants, such as assisting in getting a state health assessment, collecting water samples for countrywide projects, and partnerships that will help better understand the burdens of PFAS contamination and related chronic diseases. Since 2014, she has worked on protecting military families and communities from these unnecessary exposures. Bailey is known for outstanding leadership, environmental health advocacy, organizational skills, and her powerful testimony of overcoming illness and losing her family members. As a mom of two, she strives to transform her children's future by providing communities with knowledge and resources to take on these challenges. Stel, take it away, please.
Thank you so much. And I want to thank everyone that has been here through this entire day with us, presenting, and for the National Academy of Sciences for being here and to listen to us. I'm going to bring up a slide real quick where I want to start with my personal journey so you understand why I became an advocate. So in 2013, my husband was deployed to Afghanistan, and while he was deployed, my uncle, who lived with my family but was not blood related, was diagnosed with cancer and passed away not too long after. And then our family dog had cancer and also passed away. And then our brother, at the age of 21, was diagnosed with Hodgkin's lymphoma. And then a few months later, I was diagnosed with Hodgkin's lymphoma. And then my father was diagnosed with multiple myeloma. It's really important that I point out that it took 6 doctors to get my diagnosis, even though I had a little brother and an uncle who were just diagnosed with cancer. They told me it's impossible. It is impossible that you have the same exact cancer or you even have cancer just because your brother was diagnosed 3 months before. So that just presents one of the many challenges that we face when we're in an exposed community. So my husband came home from one battle and had to fight another battle with his wife while I went through chemotherapy and radiation. And I had a 13-centimeter tumor in my chest. And going through 6 doctors to try to figure out why I couldn't breathe and why I had lymph nodes swollen. This isn't just my story. We have many people in our community that have similar stories. And one of the questions we always got asked was, where did you grow up? So I made it my life mission to learn about where I grew up. And I learned in 2018, when the Department of Defense report came out, that NASA, Cape Canaveral Air Force Station, and Patrick Air Force Base were contaminated with perfluorinated compounds. Patrick Air Force Base found over 4.3 million parts per trillion of PFAS in their groundwater. So through that report, I was able to connect with an oncologist. I had spent many years, since 2014, when I was told I was in remission, crowdsourcing autoimmune and cancer diseases in my community. And I was able to connect with an oncologist through this, oncologist Greenwald. And she had cancer herself, and she went to Satellite High School. This school is directly next to Patrick Air Force Base. She had learned that 54 graduates of Satellite High School were also diagnosed with cancer at very young ages, starting in their 20s. She lost a really, really close friend to rare cancer. She went through cancer, and multiple of her friends diagnosed in their 20s. If it was not for having this professional support in our community, I truly believe that there would be a lot of other patients that would not still know today that they have cancer or an autoimmune disease. That support meant everything in our community. She helped collect 54 confirmed cases under 40. Some of the things that we were seeing was Hodgkin's lymphoma, testicular cancer, kidney cancer, leukemias, thyroid cancers, brain cancer, breast cancer, colon, ovarian, bone cancer. And so all of these under 40, she really helped spearhead and spoke at a lot of meetings and helped us start connecting those puzzle pieces as we did water testing and found that perfluorinated compounds wasn't only in our groundwater, but it was also in our drinking water. And especially at the Satellite High School, they did not find PFOA and PFOS, but they did find PFBA. Since 2018, we've had a big group of people helping us, and these are just some of the few people that we've lost since 2018 when that DOD report came out and that began helping us. 33 years old at breast cancer, colon cancer at 39, prostate cancer, breast cancer at 36, cervical cancer, leukemia, brain cancer at 17. She just turned 17 3 days after, 3 days after she turned 17, she passed away and lost her life to brain cancer. Her father being in the military and went to Patrick Air Force Base. With our crowdsourced information, we were able to collect numerous diagnoses with both cancer and autoimmune, but we only started mapping cancer cases right directly next to Patrick Air Force Base. And the reason why we chose to focus on Patrick Air Force Base and wait on focusing on Cape Canaveral Air Force Station and NASA was for several reasons, but one mainly because in 1990 there was a cancer cluster investigation where there were 40 cases of Hodgkin's lymphoma within a few block radius, and they were all Satellite High School students that had Hodgkin's lymphoma. If you don't know much about Hodgkin's lymphoma, back then the toxicologist said that there should have only been 2.46 out of 100,000 cases, and there were 40 cases. And that's why there was a investigation. So we were able to also push for our own health investigation, cancer assessment within the county and 2 zip codes. And that found that there was an increased risk of certain cancers among males and females. We're seeing urinary, bladder, leukemia, liver, lymphoma, breast, testicular. We have other concerns, liver damage, increased risk of thyroid disease, birth defects. And routes of exposure that we're most concerned with is fish in our Indian River Lagoon, because we've found this in wildlife's blood. Produce such as citrus trees. We all grew up eating citrus trees in our backyard. We have orange trees, we have grapefruit trees. We would always constantly pick those off of our trees. And drinking water. We've detected more than just PFOA and PFOS. We've detected short chains too. My main message tonight is early detection saves lives. When cancer care is delayed, it lowers the chance of survival. Our community examples of awareness of PFAS have encouraged people to go to their doctors, and we have actually been able to save lives because we've worked with physicians to do so. We had a few women who had thyroid nodules removed. We've had another woman that had 12 breast cancer cases on her street, and she decided to get checked up, and sure enough, detected breast cancer early. We had a service member who swam in an online canal off base where firefighting foam was released and learned he had testicular cancer. We just had 10 new breast cancer cases a week ago, 10 in 1 week diagnosed. And another very important factor that I want to bring up, all of this sounds insane probably to people watching from the outside, but after learning that a previous homeowner had leukemia, a new homeowner found that her son had leukemia, was diagnosed with leukemia after that previous homeowner moved out and they bought the home. I feel that we are doing physicians a big disservice by not providing them the information. Lacking this guidance is only harming people, and we need to save lives now. And I have given plenty of examples of how we have already done that within our community. What we would really like to see is physician education, and we continue to push for that in our community, and working closely with our physicians, I think has really made a tremendous difference in being able to help save lives. Medical monitoring, PFAS blood testing, that data is just so important to see who was exposed. I would guess that the people that live directly next to the base and those that work at NASA have potentially higher levels in their blood, but we wouldn't know because we don't have access to blood testing. Preventative health screening and assessments, as I've provided today, some examples of how we have already saved lives and been able to do early detection just from that alone has made a tremendous difference. Documentation on medical records of PFAS exposure and recognized established guidance for insurance coverage. And one of the questions that a few of our physicians started putting on their medical forms is, have you been exposed to any environmental toxins or chemicals in your home or workplace? Where do you live? On these medical forms. And I think that's really important to notate and take into consideration today as well, because with so many impacted bases, military bases and surrounding communities and firefighters and everyone else who's dealing with these toxins, it's important that they have that conversation with their physicians. It's a simple conversation with awareness and being able to learn how they can go ahead and monitor their patient's health and do that preventative health screening and assessments, because that can give somebody the quality of life. I want to thank you guys so much for allowing me to come on here again from Florida's Space Coast, where we watch rockets and shuttles launch from our backyard. I am just so grateful for all of the experts and everyone that has helped take part in this, and especially for oncologist Greenwald and her amazing work within our community to help bring awareness and advocate for the people that are suffering. Thank you guys.